changes. All right, with us now is Congressman Joe Sestak. He is a Democrat representing Pennsylvania's 7th District and also a candidate for Senate in 2010. Congressman Sestak voted for the health care reform bill. Thank you for coming in today.
It's good to be here.
We spoke before briefly about this. This was kind of a personal issue for you. Why don't you briefly explain that, how it is for you and your daughter?
After nearly 3 decades in the U.S. military, my 4-year-old was struck with the same brain tumor that Senator Ed Kennedy had, and given only 3 to 9 months to live, she's here today because of the health care plan that we have. But I was always struck. I got into Congress in order to pay back. This is a personal debt. But I was struck in the military why we give everyone health care and their families. It's not because we're generous. It's because the dividends that accrues to this nation. You have a healthy, focused warrior. And so that's why I work so hard on this bill.
What if you weren't so fortunate to have that health insurance being in the Navy?
You know, I probably would have been bankrupt today. When my daughter began her chemotherapy, a young 2.5-year-old boy was in the bed next to her, just diagnosed that morning with acute leukemia. For 6 hours, social workers came and went to see whether he could stay because his parents did not have health insurance. He stayed in that case. But that family will probably have bills
forever that they will never pay. All right, now this is the House version. Later on, the Senate would get to their bill, and who knows what we'll end up with in the end. But under the House version, poorer people have to have insurance or pay a penalty on their income. Average income people and poorer people will get subsidies. They will get help. How will this work? Because a lot of poorer people, frankly, don't do a lot of paperwork to process this kind of information.
Actually, we'll just look at their tax reforms.
Okay.
And right from there, you're going to be able to tell that they will qualify up to 400% of poverty level on a sliding scale, where the government, if it's 200% above poverty level, will pay approximately 10%. But if it goes up to 400%, the government will pay just a few percent, and you, out of your pockets, pay the rest. So that's why the bill says, let us look at your tax bill for those that would qualify for this subsidy.
2 more topics because we're running short on time. If I have insurance, can I ever be cut under this House bill?
First of all, we mandate that the employers who have large employees that have health care plans have to keep it or pay an 8% payroll fine, which is more than they pay today to provide health care. Second, it's mandated everyone must have health care. And so if you're laid off because the company goes out of business, then you go into this health insurance exchange and can pick any type of health insurance plan you want, the public option, or if you choose, a private one. What it does is begins to say to everyone, look, no longer do insurance companies dictate and ration care. Pre-existing conditions like my daughter would have, no longer can she be denied coverage. Everyone is covered, so we have healthy, focused, productive workers.
You're in a unique situation because you're running for Senate, the race next year. What do you anticipate a compromise bill is going to look like once the Senate brings up their side and combines it with the House side?
Obviously, I hope a compromise won't be necessary, but what I see is it'll come down to 2 major issues. The public option, which is a choice, not funded by the government, but by the premiums and copays of those who choose it. Others are opposed to it, so it might end up being a trigger. That is, if health premiums, like in Pennsylvania, which doubled the last 8 years, continue to rise, it would trigger that you bring in the public option to have a fair competitor out there in order to get that fair competitive pricing. That might be end up being where. Second is, how do we pay for this?
And who pays for it?
Right.
Okay.
And so right now, there's nothing added to the debt, but we do it by taxing certain individuals. That may change.
All right. It's going to be interesting to see. Thank you very much for coming in, and we'll look forward to seeing what happens in the end, how this is all resolved.
This is very important for us.
Congressman Joe Sestak. Dawn?